From the outside looking in, treatment can be a little bit scary for parents and for clients. How are we helping clients find the right level of care for them?
Yeah, I mean, when a family member or a client themselves is looking at going to treatment for the first time, it can be pretty daunting because there are so many different levels of care. Traditionally, most people hear about going to a residential program, but there's so much more to the whole treatment cycle. There's stabilization. That's typically with mental health primary clients. There's detox for substance use clients. So a lot of people will sometimes start at the detox or stabilization level. Then they'll work their way down to a residential program when it's most appropriate. That's typically about 30 days. And then they'll get to us over at Launch Centers, and that's our PHP and IOP level of care. So PHP stands for partial hospitalization. I know it sounds daunting saying partial hospitalization. There's no hospital involved, but it just means a little bit of a longer term care in the sense of we operate 5 days a week for 6 hours a day. Most clients at Launch Centers will be at that level of care, insurance dependent, obviously, for around 3 to 4 weeks, and then they'll phase down to IOP level of care. That's where we really do a lot of the work. At IOP level of care, they're with us anywhere between 2 to 3 months. Starting around 5 days a week and then tapering down to 3 days a week. When they start the 5 days a week, they're with us for 3 hours. And then when they work down to the 3 days a week, again, it's 3 hours. So, again, starting at the top, there's detox and stabilization, then there's residential, then there's us, the sweet spot. It's the continuation of care, typically for a lot of clients, the PHP, IOP level of care. Once they graduate, then they go into outpatient, which is just your weekly therapy appointments with a therapist, psychiatrist, whatever it may be.
Yeah, and what would you tell a family that doesn't really see the importance of having that continuity of care for long term?
We see the most success with clients that continue on for a longer lifespan in terms of treatment. So some people think, oh, the 30 days of residential, I'm done, I'm cured. There's a lot to it. And I think you're just building your skill set at that 30 days, and then you're able to apply that once you get to the PHP, IOP levels of care. So that's where we see a lot of success with our clients, when they stick with the plan and then they continue on into that, level of care.